My name is Malcolm Stark. I'm the chair of the Network of Schools and Programs of Population and Public Health, and we're really very pleased today to be hosting this next uh, presentation in our series, in our dialogue series. And I have pleasure in welcoming Dr. Yamu and Dr. Gilbert. I'd first like to acknowledge that I'm um, joining today from the traditional and unceded territories of the Coast Salish people, and I invite you all to think about the lands that you're joining from. We're very pleased to have Mark and Mui talk to us today. Um, about their project, which is called Fostering Workforce Capacity for the Digital Transformation of Public Health. And they'll be talking to us today about advancing digital competencies in Canada's public health workforce. This is particularly relevant because we will soon have access to the revised Public Health Agency of Canada's core competencies, and we'll provide a link to all of you if you haven't yet received that, um, so that you can be added to the mailing list once those competencies are available for public dissemination. So just a little bit about Mark and Mui. Dr. Yamu is a CIHR Health Systems Impact Fellow at the BC Centre for Disease Control and a postdoctoral fellow at the UBC School of Population and Public Health. He's a physician by training, and his research focuses on how digital health programs can support equitable access to services through implementation science, design thinking, and evaluation methods. Dr. Gilbert is a public health physician at the BC Centre for Disease Control, and he's also an associate professor and partner at the UBC School of Population and Public Health. He holds a CIHR Applied Public Health Chair in Sexually Transmitted and Blood-Borne Infections, and his research spans digital public health, sexual and gender minority health, and the intersections between the two. And together, Mark and Mui lead the Digital Public Health Project at UBC. So without further ado, I'm going to hand over to them for a presentation. Just to mention to those attending that if at any time you have a question, please, if you could add that to the chat, and then we'll come to those at the end of the presentation, as well as address some specific questions that Mark and Mui have constructed for our discussion. So thank you, Mark, Mui, and over to you.
Great. Thank you, Malcolm, for that kind introduction. And thanks again for the opportunity to present today. I'm going to start the presentation, and then I will turn it over to Mui to talk about the study that's the basis of the presentation, which was work that he led for our team. Next slide. Thanks, Mui. So just also to acknowledge for us that, we're based at the UBC CBC. And so right now I'm actually calling in from UBC, the traditional unceded territories of the Musqueam Nation, but also just recognizing all the Coast Salish peoples, including the Tsleil-Waututh and the Squamish nations as well. And very grateful for the opportunity to live and work on these lands. So our objective for today, this is presenting to you some of the findings from a research study which we completed, which was looking at digital public health competencies and training. And we've talked about this with different groups, but haven't yet had the opportunity to robustly discuss this with other public health educators in Canada. And that's kind of our personal objective for today. We're quite interested to hear your feedback on our findings. And again, just to thank very much the network for your support with this study and the chance to speak today. In terms of what you may be able to get out of today's presentation, we're going to, hopefully, you'll be able to learn about, you'll be able to describe why digital competencies for Canada's public health workforce are important, explain different approaches for training in digital competencies for the public health workforce, and assess how digital competencies and training approaches apply in your context. So, so I'm going to speak to the why, like the rationale for this study that we did, and why is looking at the digital public health workforce important. So first, you got to click for animation, Lee. Yes. So first, we'll talk about digital technologies. We all know that digital technologies have been a mainstay of public health practice for decades. With informatics, digital health promotion, digital data, like there's many applications of digital technologies in public health practice, and that's one of the reasons why this is important. Next slide. COVID certainly brought this to the fore with the real explosion of digital tools in the practice of public health, and just some examples of which are shown here, and sort of highlighting, some of the relationships between, say, public and private sectors, as well as sort of research and practice and technology. Slide. And currently, we know that there's many new innovative ways that people are using digital technologies in the practice of public health, including social listening and looking at social media for public health reasons and perceptions on different topics. On the left, just, things like digital storytelling and sort of like, other kinds of techniques and methods around digital health promotion. Artificial intelligence for public health is clearly a huge topic, and I know there's been previous webinars on that within this group. And as well, the one on the right is just an example of a project which was sort of precision public health, which was using municipal data to predict homelessness and to intervene with people at risk of homelessness in Los Angeles. So digital technologies are still very much part of practice, and it keeps changing as new technologies become available. Next slide. And this was really recognized in 2021. Theresa Tam's report on the state of public health in Canada 2021, which was about transforming the public health system, and identified medical and digital health technologies as one of the building blocks, like how public health system can carry out its functions. So next, we have the digital transformation of society. So we know that the digital technologies, the internet has sort of transformed society and keeps transforming society. Next slide. So again, with COVID, sort of misinformation and sort of the infodemic really came to the fore as a result of COVID. And so how these digital technologies have really transformed how people access information. And has led to sort of like the COVID pandemic led to sort of more recognition of the importance of thinking through the ethics, health equity, and social justice aspects of digital technologies in public health. We see regularly news stories about how digital technologies are changing society, ranging from social media algorithms amplifying misinformation, the roboticization of the workforce, or how things like digital payment systems exclude folks who are relying on cash or don't have access to technology. Next slide. And most recently, generative AI and now this push for artificial general intelligence sort of really reflects, I think, the latest wave of digital transformation and really needing to think through the role of public health practitioners in this age of artificial intelligence. Next slide. So then the next reason is the digital determinants of health. So we're all aware of the importance of determinants of health. Next slide. And so, we've talked about the digital divide for almost since the beginning of the internet, which, is often used to refer to the notion that people aren't able to access digital technologies or to use digital technologies appropriately if they have the access. So it's not a new concept, the digital determinants of health, but it's becoming one that's more talked about. Next slide. We know that access to the internet remains a problem in many parts of Canada, particularly in rural and remote and First Nations community. This is from 2023. The gaps continue to narrow, but there is still this discrepancy, and this directly affects as a determinant of health, particularly for Indigenous people. Next slide. And so we see varying sort of descriptions of this idea of digital inclusion and exclusion, which has multiple impacts on different fronts. Related to access to health services, for example, or risks of exposure to harmful or exploitative content online, and really being able to think through these determinants of health, which some have called the super determinants of health because they facilitate access to other determinants like income and education, is quite critical for us in public health. Next. And we see, this is from BC's recent Population Public Health Framework, which was released last year, and folks are now starting to really articulate digital environment or digital technologies as part of the determinants of health. And so that's a shift in sort of our thinking and teaching around determinants of health. And lastly, we and I have done a fair amount of work around digital public health and thinking about this idea, which is a term that people talk a lot about, but it's not well defined. And so we've been doing some work around that. And this has led to really the reason for the study that we did. Next slide. So we conducted a scoping review, which was really coming up with definitions of digital public health and thinking about its implications for policy, practice, and research. I'm not going to go into this in great detail, except to share one finding that came out of it. So the next slide, Maureen. So as part of the review, and again, thanks to Mui for leading this work, this was a review of the literature looking at the challenges in public health and digital technologies, and then what are some of the strategies that can be used to overcome these. And this is sort of an image from the paper, which describes the foundations and strategies for digital public health. And if you want to click, Mui. And so health workforce capacity building is clearly identified as one of the strategies that needs to be in place for digital public health to be successful. So, that then leads to the question, certainly if I think of my digital life course, I'm sort of like no longer as tech savvy as I used to be. And I think about that for people in continuing education as well as in sort of curriculum in schools of public health. But it's really a question of like, do we have the skills to deal with these issues? And as Malcolm had noted, obviously the core competencies of public health in Canada and modernizing those is an opportunity. And as Malcolm mentioned, those are coming out and we can think about how digital competencies could fit within those. Happy to discuss that later. But it's not just us in Canada. This is actually quite, particularly in Europe, where there's the European Public Health Association has done are sort of ahead in their thinking and work related to digital public health. You want to just click, has shown, there's sort of a recognition of the implications of digital public health for practice, and that there's a need for us to think about how we transform our public health curricula as well. Next slide. So with that, I will turn it over to
can you hear me? I think Mark's frozen, so I just want to be sure.
Yes.
Yes,
okay.
It's all good. Please go ahead.
All right, so I'll just spend the next few minutes describing our study. This was a study based off of Theresa Tam's report in 2021, which was built towards exploring ways to improve public health systems after our learnings, or based on our learnings from the COVID-19 pandemic. So in 2022, we partnered with the public health faculty at the University of British Columbia, University of Victoria, and University of Toronto's Dalla Nana School of Public Health, seeking to identify recommendations for digital competency and training updates within the curriculum for practitioners in Canada. Specifically, we had three main questions. We wanted to understand what the current knowledge base regarding the state of training and practice competencies for digital competencies look like. What practice competencies might be specifically needed within the Canadian context, and then what types of inter or transdisciplinary partnerships might facilitate those competencies that we identified in the literature. And so we based our entire study off of the first two steps of Thomas and colleagues' approach to curriculum development. This is a framework that has been used quite frequently within medicine and public health training design. We wanted a people-centered approach to designing the curriculum or whatever recommendations were identified. And so the first two phases of our study really addressed the first step of Thomas's framework, really trying to understand, identify the problem and understand the needs for these digital competencies. And so we did a rapid literature review and then supplemented that with an environmental scan of training programs and courses around the world that are already thinking about digital competencies for public health. And then in the final phase, we took our findings to engage with public health practitioners across Canada to understand from a targeted perspective how we might be adapting the recommendations we identified to the Canadian context. And so I'll describe our findings or our methods first in sequence, and then the findings from each of the phases. So for the first phase, which was a rapid literature review, we adapted Joanna Briggs Institute and WHO's framework for rapid reviews. We searched the literature in December of 2022. We looked at multiple databases, including Google Scholar for Grey Literature, and even did automated forward and backward citation searches using Citation Chaser. All of this was aimed at ensuring an inclusive, rapid literature review. We did a screening. 25% of the titles and abstracts were screened by 2 researchers, and we iteratively discussed the discrepancies. And then once we had a clear understanding of the inclusion and exclusion criteria, the remaining titles were screened by 1 researcher with review from the research team on an intermittent basis. We extracted the data using pre-tested extraction tools and then mapped our findings to the PHAC competency framework. At that time, we only had the 2008 framework. So that's what we'll be referring to, though we acknowledge that much work has gone into an updated framework at this time. So what did we find? We found that out of 2023 studies that we initially identified in literature search, only 12 articles could be included. And one of the things we noted when we did that, our search and screening process, was an acute recognition within literature of competency gaps with very few clear recommendations on how we might be fixing those gaps. Within literature we found, most of them were from the United States. Most of them were published pre-pandemic. Only about 3 of them were published within the last 5 years of our study period. And like I said, there were very few literature offering very clear recommendations. Most of these literature were actually from a health or public health informatics perspective. But we still identified clear recommendations. In fact, we had 45 core competencies for core digital competencies for public health within the literature we identified. And when we mapped them to the PHAC competency framework, they mapped onto all competency categories, with potentially a new category around data or digital data management and data governance. And so here I just identified examples for our review. So for example, around data governance, we talk about things like being able to contribute to public health information systems that are interoperable with other information systems within the health ecosystem. But across the board, we were finding that even the competency categories that exist already will be requiring some significant change if we're to be adapting to current context. So for example, in public health sciences, thinking about being able to design, analyze, and report health science data by blending our traditional methods with modern computational analytic methods that leverage tools like R, Python, and more automated systems for data analysis and data presentation and interpretation. And across the board, we found similar conversations about what competencies might need to be adapted. From a disciplinary perspective, because one of the things we wanted to identify is what disciplines are helping to deliver or are pointed at as being important in delivering these competencies. And we found 2 main categories of training approaches within the literature we found. First were those that suggested adapting existing degree awarding programs. So things like expanding the core competency trainings to have specializations like data science, informatics, but then ensuring that there's practice-informed embedded training within real-world context. And then there were also suggestions around ongoing continued education or professional development programs. And specifically on the disciplines we talked about, trying to identify, there was talk about engaging more deeply with public health informatics, with computer science schools, information science, biostatistics and mathematics, health communication, sociology, and then management sciences. And so in the next phase, we wanted to see how these competency recommendations were translating into practice, at least within the schools of public health across the world. So we did an environmental scan following a 2-stage process. First, we did a systematic search for all digital public health programs and courses in March of 2023. So we did an advanced search on Google and then explored public health schools directory. So things like CEF, ASFA, the Association of Public Health Schools in the European region, and other similar directories, trying to identify schools and programs that were identifying the need for these digital public health programs and implementing them in practice. And then once we identified the courses, we looked within their curricula as posted on their websites or online documentation to identify schools that had a clear mandate for trans or interdisciplinarity, and put out calls to engage with the program directors or program leads of those programs to understand from their perspectives what will be needed or what their experiences were with such transdisciplinary programs. And so based on that, we did a content analysis of our interviews. And so at the end of the day, we had identified 58 programs and courses that really met our inclusion criteria. And out of these, 22 had that clear mandate for inter or transdisciplinarity. And we were able to engage with 4 of the program directors in interviews. To give a description of the programs we identified, of the 58, most of them were at the graduate level, so 46 were in master's program, 8 were either PhD or in other categories, and then 4 were undergrad programs. The majority of them, as expected, were from the US, about 35, and then 6 were in Canada. 31% were in Europe, and then 5% in Asia. So what did we find in this, in the environmental scan? We found 3 main categories of programs that were trying to identify specific or address specific competency needs as we identified within the literature. So the first one were programs really focused on public health data sciences, and this really focused on using modern analytic methods to adapt or to address and leverage new digital data streams. So the idea of big data and using big data to address modern or contemporary public health programs or problems. Sorry. They were primarily led by biostatisticians with collaborations from computer science, public health sciences, and we have examples of such programs, the Masters in Public Health Data Sciences in Boston, Columbia, Temple, and then a very interesting program in McGill, a partnership between McGill and Bordeaux, really focused on public health data sciences. And really the competencies here focus on being able to acquire, integrate, clean, and then leverage complex health data sets to answer complex public health questions and provide insight into complex public health problems. They leverage advanced data analytic techniques, including artificial intelligence, machine learning, and more traditional statistical modeling, but encourage fluency in some of the programming languages like Python, R, and all of the other data presentation tools, including Tableau, and so on and so forth. What was important for them was the cross-disciplinary collaboration. And for the Bordeaux program or the McGill-Bordeaux partnership, it was very interesting how students were put up in triads, leveraging skills in computer science, in public health science or data science, so that people establish some form of common vocabulary in collaborating and understanding of different perspectives when bringing those perspectives into public health problems. Another key piece for these programs was understanding how to ethically leverage these tools while ensuring that the governance of the data protected the interests of the public. Okay, so the next category was a group called Public Health Informatics, and this was the second most popular group of programs here. Like we talked about, the first 2 programs really addressed that new competency category we identified within the literature around managing digital data and leveraging it for public health use. Here, while the first group of programs in public health data sciences talk about analyzing, public health informatics, on the other hand, really focused on how we design the infrastructure that enables the ability to actually leverage the tools in analysis. So what is the basis for the public health data science? The informatics was described as key. And here it was led by public health informaticians in collaboration with the public health sciences. Few actually integrated real hands-on learning with industry-based partnerships for training. And we have examples from different universities like Johns Hopkins, Columbia, Emory. Like I said, they really focused on that capacity to design and integrate digital systems for health data workflows. ensuring the infrastructure management that enables analytics, ensuring interoperability and setting standards for interoperability, but also ensuring basic cybersecurity and data governance. The third category, which we found really interesting, had only 13 programs in it, and they addressed a broad range of digital competencies, mostly driven as in their online materials, driven by market needs for real-world experience around some of the more contemporary digital problems that we face. So, for example, how can public health practitioners be able to critically appraise digital technology's role in public health systems, the underpinning regulatory frameworks, and how we navigate those when thinking about public health sciences? How can we design and evaluate public health interventions that leverage digital technologies? What competencies are needed to understand the digital determinants of health at macro, meso, and micro levels? But also, how can we ensure strategic leadership and project management for such competencies? So a broad range of competencies addressing varied issues within the public health space. Okay, so when we talked with practitioners, the leads of the programs, the program directors, we found that there was a central idea of creating a T-shaped professional. This is one we describe as someone with broad base of knowledge, but a depth of knowledge in one of those specific areas. So the example here is for one practitioner who's a real expert in public health sciences, but understands how to leverage computer science, new media communication to ensure that they can deliver on their core area of expertise. And so how can we be building this T-shaped professional within our core programs and courses? And to do that, they leveraged an interdisciplinary curriculum design, beginning with the vision for this T-shaped professional and building coursework around the students to ensure that they can actually deliver on this vision. But there were key challenges that this program director described. First off is the idea that there's no common idea of what digital public health is and what the boundaries of digital public health is. And I think it stems from our original fuzziness around the boundaries between public health and health systems or clinical services, as it were. But then there are also problems around having a shared vocabulary. So imagine having to work very closely with the computer scientists who have slightly different views entomologically on how knowledge can be generated and how we judge what knowledge is versus, say, in public health sciences. And so those frictions were described in detail within our conversations with the directors. But also there's the idea that there's always resource constraints. How broad can you go, really, with all of these different competencies that we need to build? Or how deep do you also need to go when you have an already dense curriculum for public health practitioners to engage with, especially within the graduate courses? And then finally, the idea that there were challenges also recruiting the ideal students for such programs who would understand the needs and demands for transdisciplinary practice. So in the final phase, we took all of our findings and talked with Canadian public health practitioners. And so we did a what's called an interpretive description of public health practitioners' perspectives in Canada. We did focus groups with Canadian practitioners where we purposively sampled practitioners who had at least 3 years of experience, who are familiar with digital technologies in public health. We actually did at least 3 years of experience to account for experiences within COVID, because at the time, we're just coming out back end of COVID. We knew that there was an explosion of technologies during the COVID pandemic, and we wanted to leverage some of those experiences in this conversation. I want to again thank NSPPH for supporting some of our efforts to recruit practitioners across Canada at the time of the study. So between November and December of 2023, we did 4 focus groups, where we explored people's experiences with digital technologies, then reviewed our preliminary list of competencies and tried to understand from their perspectives what adaptations needed to be made for these competencies. We analyzed the data using reflective thematic analysis. I have left a link to that paper and encourage you to dig at it in depth. But just to summarize, we had a total of 19 participants in all across Canada. So 5 were from municipal and regional health authorities in Eastern and Central Canada. 4 were from regional health authorities in Western Canada. And then the others were we had 6 from Indigenous Services Canada and other federal institutions serving equity-seeking populations or equity-owed populations. The high-level summary of our findings were in 3 themes. First was a recognition of the importance of these digital competencies, but also a simultaneous recognition that the public health systems must evolve to support these new competencies. So the idea that if we are developing competencies, but the systems are still in their current siloed fragmented configuration, then it will be difficult to actually progressively implement those competencies in practice. They talked about how in this time, people are actually trying to leverage these competencies as they learn them on their own, but are surviving or are thriving despite the system rather than because of the system. And so it really emphasizes the need for some simultaneous advocacy around system evolution. And I think within other contexts, for example, in Australia, there's the idea of digital capabilities framework, where they are looking at both the systems and how to adapt the systems in tandem with adapting competencies for practitioners who will practice in the systems. But then they also talked about the need for strengthening the basics in digital competencies before extending towards advanced competencies. And this was in 2 directions. First off was the idea that because the public health workforce is really diverse, we must be thinking about ways to ensure people have basic digital literacy first. Giving opportunities for practitioners to have these literacies can potentially improve some of the tools that we already have in existence, being able to collect e-forms, for example, or digital forms, or data from in digital forms, before even thinking about deeper analysis. But then extending beyond that is the idea that we need to be building general competencies with options for specialization. So how can we have, from a public health lens, first, how can we have people generally understand the role of digital technologies across all of the public health sciences, identify opportunities where digital technologies can be leveraged, but also be on the lookout for the potential risk and unintended impacts that the technologies might have on their work and on public health outcomes. And then providing specific roles for specialization based on interest, but also based on need. So how can we have some of these more specialized programs that I talked about, for example, the public health data science programs or the public health informatics programs, where people can then further specialize where needed. And he talked about this in twofold, whether that can be provided in continuing education, but also provided through the existing programs through the schools of public health. And so we coalesced some of the findings that we had to highlight a few recommendations we might make for improving digital competencies for public health. So we need to be thinking about ways to integrate digital competencies into public health and other relevant competency frameworks. And I recognize all of the work that has gone into PHAC's new framework. We're also thinking about ways that we might be thinking about even updating beyond that to really closely look at our frameworks and think about how digital might play a role. This is a similar recommendation to what ASFA has just made through their digital public health workforce, competency workforce, where they're also recommending a review of the curriculum to think about ways where digital technologies can be considered more closely across the board. And we've identified within our own studies ways that we can think about this. So in terms of our general public health competencies, how are there those that intersect with digital technology? So for example, we think about public health analysis. Are there new methods, tools, techniques that we can be thinking about in such contexts? So across the board, how are we thinking about it? But then there are also competencies that are specific to technologies in themselves. So some of the programming competencies or some of those prompting competencies for generative AI, for example, those are specific to digital technology. But then we also need to be thinking more clearly about the digital literacies across the workforce. So how are we better able to support the diverse workforce? One of the things we found in our study was that, younger people are more tech savvy, but don't necessarily understand the public health implications of the technology. The older folks are more clear-eyed on the public health implications of technology, but may not be tech savvy enough to identify them quickly or in a way that is understandable for the rest of the workforce. So how can we be fixing such gaps? For the curriculum, how are we making changes? First, we need to be thinking about tiered approaches, and this was something we actually effected to our own findings based on the recommendations of the public health practitioners we talked to. So, sometimes it is okay to just be aware of the technology or the role of the technology in a context. At other points, or based on people's roles in the system, there may be need to be able to design and apply and evaluate such technology. So how can we be thinking about different competencies at different levels of use within the public health systems? But we need to be thinking about this with a public health first lens. But beyond the basic competencies, are we able to offer specialized pathways for pathways for specialization for people who are interested in such skills, and so that they can help bolster the public health response within different contexts? And how can we strengthen, like I said, by starting first with basic digital literacy? This is something that's foundational, but often overlooked within our public health systems and public health training. We, through our findings, also articulate a few ways that we can facilitate some of these curricular updates. So we can think about instituting ongoing inter and transdisciplinary collaborative curriculum development. So thinking beyond our usual partnerships for public health curriculum development, how can we be thinking about engaging with the mathematicians, engaging with the computer scientists to really bolster and develop a more robust public health curriculum. So that will in itself require us to develop new partnerships, like we talked about. But beyond that, we need to be thinking about ways to engage with health systems partners to co-design this curriculum or curricula in ways that is useful for the institutions that we expect practitioners to engage with once they are out of school. One of the things that some of the participants in our focus groups highlighted was the fact that being trained in clean systems, straightforward scenarios didn't necessarily prepare them for the messiness of the real world. So how can we be tailoring training to what exists out there? Finally, on the training programs, like I was already hinting at, we need to be expanding training programs to cover broader digital competencies beyond just the specialized training. There seems to be quite a bit of focus on the public health data sciences, public health informatics, but then there's a lot of opportunity in the third group of programs that we found that really think beyond these two specialized areas. So think about a public health first lens in understanding how we might leverage technologies for public health good, but also understand, identify, and evaluate and address the threats of digital transformation within society. We also need to be building transdisciplinary training programs with the goal of creating these T-shaped professionals. So being able to train people in transdisciplinary contexts that will be similar to what they eventually practice in real world contexts will be very important. But then we need to be integrating applied training in real world contexts. So I know that, for example, the MPH programs have practicums. How can we be expanding this to actually strengthen understanding of real world context within the context of digital technologies and how they are applied? But we must anticipate that there will be challenges. I know that we already have dense curricula, but beyond that, in establishing new partnerships, like we talked about the experiences of program directors, there will need to be clear allocation of responsibilities, clear governance of those partnerships, having clear goals for such programs, and then figuring out what resources need to be used to actually build up such programs. This will be all very important to consider, but we must do that from a principles-guided perspective. At this time, I think we had put up a few questions for discussion, and I can put them up and we start stepwise. But I'm also eager to learn from the audience what they think about what we've talked about in these few short minutes. Left up the questions here.
Thank you, Mui and Mark, for a wonderful presentation. Very, very comprehensive and beautifully put together. And just to remind everyone that we are recording today's webinar, and so you will have access to review these slides once again. Please post your questions into the chat so that we can see them, and I'll ask for hands as well. But Mark, can we open up a little bit of space just for general questions? And then perhaps they might sort of be geared towards the ones that you've posed, but just to give people opportunity for that. So let me kick off with a question while folk are thinking about their own questions. Clearly, as one would expect, a lot of this work is geared towards supporting quantitative methods within public health practice. I wonder if you could say something about and talk about your considerations of digital technologies applied to more qualitative work. For example, we're sitting on a Zoom platform right now, and I didn't hit AI Companion to get a summary of today's meeting, but there are, there are obviously a number of applications that are geared towards qualitative work, as we know in qualitative analysis, like NVivo and Qualtrics and other things like that. So perhaps if you could talk a little bit about where digital technologies and digital competencies would fit into the so-called qualitative space of public health.
I could start, and then Mark, if you want to hop in. So I think what we did was to remain agnostic of the methods and the tools, but to really engage with folks across the board to understand where their roles are. I think I might have given the impression that we focused on the quantitative side because of the examples that I gave. We had 45 core competencies identified, and this cuts across the board from analysis to, policy and advocacy to health communication and health promotion. So, for example, there are competencies around how to tailor communication through different social media channels, targeting different populations based on where they know that they access their health information. So in terms of specifically addressing your question around qualitative, I think one of the things we do notice within the literature is that there seems to be some bias towards quantitative methods. And I don't remember finding specific examples of competency statements around using tools like NVivo, for example, or using AI companions to analyze qualitative data. But I think that some of the competency statements we identified talk about being able to leverage new tools to analyze quantitative and qualitative data. So again, it stays really agnostic of the technology, but gives direction to schools on how to, for example, think about what new tools exist and how they might be integrated within different contexts, including qualitative analysis.
Thank you for that response. I have one other question to pop into the mix. Then I'll come to you, Abel. Or let me first allow you, Abel, to ask your question, and I'll hold back my second one.
Sure. Thank you so much for this. That was very important work and very well presented. I have a question that is related to your point 3 and 4 here. And is related to the resources that are available to basically being able to revamp programs in institutions like universities. So in the current environment where it is very difficult to find those resources, through your environmental scan, have you find things that work better than others, or perhaps cost-saving opportunities that could give us some strategies to really incorporate more digital competencies without basically having to drive that many resources in those programs?
That's a very important question. I think I'll take it in two parts. We did find a few examples or exemplars of ways, interesting ways program directors and programs generally are finding to integrate some of these competencies. So for example, some of the programs were based off of, agency funding. So for example, in Canadian context, we're talking about tri-agency funding. These were schools in other regions. So like in Germany, I'm not sure exactly what mechanisms they use. But there's a question about balancing those types of approaches with sustainability, because what happens, for example, if funding is not renewed, which was the case for one of the programs that we actually identified. But others are finding other ways to do this. One of the interesting ways was engaging with industry partners to have funding from industry partners and co-leadership from industry partners for those programs. How that will work in Canadian context remains to be seen. I'm sure people can think about it, but I found it really interesting. I think there are a number of schools in Australia using this approach to ensuring that there's a bridge between those programs and then the institutions that they eventually might work for. But again, it comes down to sustainability. How long can these kinds of arrangements work for? But what we've been told is that if such programs are well designed and then they become really attractive for students, especially international students. Again, we know the context in Canada right now, but at the time it was described as something that becomes really attractive for international students, which potentially can fund some parts of those programs.
Thank you, Abel. So let me ask this question, if I may. You've made reference to this and partially answered my question, but I wonder if you could elaborate. Is that in the sort of the world of competencies, we recognize that there are core competencies. So the PHAC 2008 core competencies and the revised PHAC competencies, which will soon be available. And just to alert everyone today to the posting in the chat, which would allow you to subscribe to receiving the competencies once they are will be finally disseminated in the public realm, although they were shared at the Canadian Public Health Association meeting. So this question that I'm asking is really about where best to locate digital competencies. So, does one locate them in the core competencies? And you seem to be suggesting that that is done. And in fact, you suggesting, I think, that not only are they located there, but that perhaps they could be tiered and so made more specific. And then there's also the area of specialized competencies, having a complete separate list, which might relate or resonate with the core competencies. So as you move forward to bring your work to a close and wanting to integrate your work or see your work integrated into competency statements, where best do you think this is done? And Mark, you were a member of the advisory committee to the revision of the core competencies, and so you've had an opportunity to see those, and perhaps you might want to reflect whether they better expand on the digital competencies that you would like to see integrated.
I'm happy to take a stab at that one, Louis, and then you can add your thoughts. Yeah, thanks, Malcolm. It's something we've been thinking about, especially with the revised core competencies coming out. And I think sort of our recommendation around sort of integrating within those, will probably require a bit more thought in terms of, exactly how best to do that. I think because, I know that the core competencies, right, are designed to not be specific to a particular topic area, right? So their core competencies are foundational. And so, clearly some of the competencies we identified do fall much more into the specialized camp. And so I think that would be probably the exercise of going through to see what might be relevant, that is a bit more general, and then, really think about a specialized piece. I'll just give a shout out to Jennifer McGruder, who's on the call, was also funded through the same grant opportunity, and has just sort of released specialized competencies around communication and public health. And I think that's another model we need to think about, like how this fits. I think just integrating everything into the core competencies obviously doesn't make a lot of sense with the framework that it has. And I think we just really need to figure out how to make this the most useful, right, as well.
Thank you. Okay, so there is a question from Erica. And Erica, I'll read your question and please feel free to elaborate if you wish. Did your scan identify a good resource to build basic digital literacy among the public health workforce?
Good question. Short answer is no. If I were to lengthen it, I would say, first off, we went into this scan really focused on digital competencies across the board. And I think we didn't find any programs that were really specific for digital literacy. So potentially that's a gap, but we know that there are already programs out there already trying to build digital literacy as it were a competency, but we do not have examples of how those are integrated within a public health training context.
Thank you. So Agnes has posted a question. I wonder if we could all read through it there, but she's thanking you for this important presentation. And that said, she recognizes the concern about curriculum overload, and that many public health programs are already struggling with that. And so suggesting that it may be feasible to integrate digital competencies through interdisciplinary modules, practical workshops, or even elective options rather than adding standalone courses. This way, students can build these skills without displacing other core content. So Agnes, please elaborate on your question further if you wish, but what's coming across to me, oh, there you are. You've posed the question. Have you considered any specific strategies or models for embedding digital competencies into the curriculum without increasing student workload, perhaps through integration with existing courses or practicum experiences? Great. That was the question that was emerging for me in your submission.
I mean, I could start, and Mark, you can jump in at any time. This is a question we've had for quite a while now since we've completed actual data analysis on this project. How can we move forward? We do know that the curriculum is already dense at this point. It's why we included one of those in our questions here. We have encouraged, I think that's just an output from this work, is to encourage ways to think about integration within public health curriculum. But to your point around having modules that are transdisciplinary and allow people engage with some of the content that can build this competence, this is something we've already started to try on our own. I think last year, we, during the summer, tried with funding from the UBC's Faculty of Medicine, tried to implement summer school, just focused on a few of the competencies we identified from our list. That can be a model that goes forward. One of the problems with that, though, is that it relies on students to know that there are these resources out there and relies on them then seeking out these resources. Does that work every time? It remains to be seen. I know that ASFA, for example, the Association of Public Health Schools in the European region, has recommended that that's not the case, or that's not the approach to take, but to really think about going back to the curricula to figure out where within the existing curricula we can, sneak in some of these contents, even though they recognize that that is a challenge for a dense curriculum. So I don't have any straight answers. I think that there's lots of minds working on the same problem. Hopefully one of us figures it out sometime soon.
Maybe just to add, Mui and I have had some discussions, because we're both based at the School of Population Public Health at UBC, and have, been having conversations with folks here about this as well, and hearing many of these same concerns. If you think about you know, should elements of digital competencies be embedded across all courses? Do you look at sort of these other options? I mean, I think the other piece of this is really like, what's the role of schools of population and public, or public health schools in terms of the continuing education, and which is probably going to lend itself more to some of these focused kinds of trainings, and whether there's an opportunity for some synergies there, I'm not sure. But this is an area that we're interested in kind of thinking more about. But it's there's not a clear answer.
So Rena, I'd like to give you the opportunity before, sorry, not Rena, Agnes, before we come to Rena's question, given that this is clearly needs further discussion and exploration, Agnes, how do you feel about the responses you've been given, and you've obviously given this thought yourself?
Yeah, I think the responses are very clear to me. It is something which does not have a clear direction. It is something to think about and see how possible, how feasible we can integrate this into the existing curricula.
Good, thank you very much.
You're welcome. Thank you too.
So Rena has asked, what are some practical ways we can keep both developers and frontline staff up to speed with digital skills, especially as AI models and advanced analytics become more common in healthcare programs?
I think we've hinted about this in our previous responses. One of the things we've really thought about is having a stronger role in continuing education and partnering with institutions to figure out where the needs are and what updates can be made. I think there are models that exist already that we can be leveraging. We know that the curriculum will have to keep evolving over time, sometimes at breakneck speed because of how quickly these technologies are evolving. But the potential ways to just figure out a continuing education, in addition to some of the recommendations around integrating in existing programs and courses.
Yeah, I would just add, I mean, I think this is also an area where we don't have the answers entirely. Like, this is one of the challenges that we are always trying to figure out, right? And we see that recently with use of AI, and you see sort of like certain folks or certain people really picking it up and running with it. But in terms of sort of like broadly thinking about this sort of across the workforce, it's not something that we've yet kind of figured out the model for doing that. But I do think that that's like, a really important area for us to be thinking collectively about how best to do. I mean, I guess, the one thing I was just thinking about this, that question could also speak a bit to what Mui raised around sort of partnerships with technology, at the tech sector, in terms of like, there might be some concrete ways of partnering with tech to sort of bring folks up to speed, as sort of like one of the potential approaches for this. Oh, I was also going to say, like, one of the other sort of, this is now getting a bit, trying to think through strategies, was one of the things that we've been thinking a bit about is like, are there, even though we know that, digital public health, as we think about it, is, not the same as digital health. There's a fair amount of overlap between digital public health and digital health. If we think about that area of sort of like clinical prevention, immunizations, health promotion, and so on, and are there strategic alliances that could be built there in terms of like bringing more public health content into sort of digital health training platforms and so on? Just some of the other ideas that kind of been shooting around or brainstorming about.
Thank you both. I'm not seeing further questions. What I've just posted in the chat is the second, I think, Mark and Mui, the second of your published articles. And also maybe give you the opportunity to talk about your knowledge mobilization report, and perhaps where that can be obtained.
You want to go to the next slide, Mui? Great. So, this is just our thank you slide. But on the left, we have two QR codes. The one at the top is a QR code that takes you to our project website that we have through the School of Populated Public Health and the Faculty of Medicine at UBC. And where all of our publications for this are posted. We have also prepared sort of a a summary report that really focuses on the recommendations that we spoke to today. The QR code is there for that as well. So that sort of crosses and provides some of the key highlights from all of the 3 studies that we presented. I think we'd also just like to thank again NSPPPH for the opportunity to come and share today. Certainly open up if there's folks who want to chat further or have ideas. Happy to hear, and you can reach us at our emails that we've got listed there. And as well, just on the right, just acknowledging all the folks who've been part of the study team around this work.
Well, thank you both. And just to check through everyone, just to see if there are any last questions that I've missed or hands. But thank you very much for your such clear presentation, and this has been really inspiring work. And we look forward to moving forward to integrating your work into our various curricula. And on behalf of the Network of Schools and Programs, Population and Public Health, I wish everyone all the best for the rest of the day, and look forward to welcoming you to further dialogue series webinars.
Very much.